Thanks for joining us. I'm David Mulco. One of the big questions tonight, why now, considering fentanyl deaths have been sharply increasing in the Rose City and beyond for years. Let's bring in Blair Best live in downtown Portland. So Blair, what does this emergency order actually do?
Well, David, to many, this may seem like a no-brainer, seeing as it's not hard to see that there's a fentanyl emergency in downtown Portland. But what this declaration does is that it requires all three levels of government to work together to find solutions, seeing as they admit more needs to be done. There's an air of defiance among some living on Portland streets.
Probably 15 years now. Yeah.
That's how long Logan's been addicted to fentanyl. He smokes and plays cards at a food truck park on West Burnside.
We smoke it every day, all day long. It doesn't hurt us at all. I mean, honestly, I just don't know how to stop smoking it.
I think it's been an emergency that deserved the attention that it's getting right now for a long time.
Kristen Gonzalez sees it daily.
When I'm walking downtown, I see people that are in need, that need help from their county and that need help from their state.
Well, good afternoon, everyone.
On Tuesday, the state of Oregon, Multnomah County, and City of Portland each declared a 90-day fentanyl emergency for Portland's Central City.
We are here because times of crisis call for focused action and strategic coordination.
We're up against a rising tide of fentanyl-related addiction and deaths that are unlike anything that we've seen before.
The next 90 days will serve as planning time.
A combination of disciplines and existing resources will be coordinated and strategically deployed for the duration of the emergency.
That will be based out of a command center in downtown Portland, where the impacts of fentanyl will be recorded and leaders will talk about what more can be done.
Declaring this emergency will help us address this and other gaps in our system.
There will be a focus on street outreach and addiction prevention. More people will be trained on how to use Narcan, an overdose reversal drug, and state police will continue to work alongside Portland police, stopping drug deals.
This 90-day response is a potentially big step towards achieving a consistent, unified system that will allow us to effectively deliver these critical community services.
A move they admit has taken them years to get to.
It's one thing to declare an emergency, it's another thing to make sure that we have resources.
Individuals who are struggling with fentanyl addiction are worth investing in, fighting for, and providing a clear path to recovery.
Even people like Logan, who has no interest in being helped.
We cannot be stopped. We will always smoke our fentanyl.
All right, so another question that has yet to be answered is, as you just saw, is how do you help someone who doesn't want to help themselves? Seeing as that is the case for many people struggling with addiction downtown Portland. So coming up tonight at 6:30 on The Story, we're going to show you a young homeless woman who's heavily addicted to fentanyl and her mother's fight to save her and why it is seemingly impossible to do so even when resources are available, showing a deeper side to what's fueling this crisis. David?
Yeah, a complex problem needing even more complicated solutions. Thank you, Blair. Appreciate your reporting.